I was delighted to present ctDNA MRD data for the ELM-2 Odronextamab as treatment for diffuse large B-cell lymphoma and follicular lymphoma study. So ELM-2 is an analysis of Odronextamab, a CD3 by CD20 antibody bispecific that has shown significant efficacy in both diffuse large B-cell and follicular lymphoma. As part of a sub-analysis, we performed ctDNA testing at baseline and at cycle 4, day 15, which was the first clinical assessment for those patients. And we were able to demonstrate that ctDNA correlated with response in those patients who were MRD negative as measured by ctDNA at cycle 4, day 15, had improved progression-free survival in both diffuse large B-cell and follicular lymphoma. In addition, we were able to look at a couple of risk factors for progression and correlate those with response to Odronextamab. For those patients who were with diffuse large B-cell lymphoma, the cell of origin correlated with no difference in progression-free survival. For those patients with p53 abnormalities, in both follicular lymphoma and diffuse large B-cell lymphoma, there was a correlation with worse progression-free survival, but this has not reached statistical significance. And it's a pretty exciting time to be looking at ctDNA. I think that for patients with treatment with bispecific antibodies, it was not a certainty that we would even be able to achieve MRD negativity status, and I think that long-term remissions are predicated on achieving that status. In the future, I'm hopeful that we'll be able to use these technologies to risk stratify patients to particular treatments, to define duration of treatment, in particular for bispecific antibodies, and then follow for any signs of early progression that would warrant additional interventions.